One of the things I'm most concerned about is actually this question of fairness in machine learning. My name is Irene Chen. I am a third-year PhD student at MIT in electrical engineering and computer science. My advisor is Professor David Sontag in the clinical machine learning group. Healthcare in particular has a long history of having disparate impact on different groups. So with machine learning, we have access to a lot more people's data, people have more voices, people get more represented in the machine learning models that we could then potentially roll out. I am working on heart failure specifically. Heart failure is a chronic condition where after diagnosis, people live on average about 5 years. We want to be able to determine what kinds of treatments will have better outcomes than other treatments based on who you are, your age, your past history, your lab results, all of that. And then there's also different types of heart failure out there, so sort of trying to figure out, are the types that we think are out there even the same types that there should be, or should it be slightly different classifications? We have really close collaborations with hospitals in the downtown Boston area, and they have allowed us to have access to a lot of their electronic health records. So every time a patient comes in with heart failure diagnosis, we can actually pull all of the other times they've come to the hospital and maybe they didn't know that they had heart failure. And we can see, oh, 3 years ago, you had this abnormal lab result and we maybe didn't think it was anything, but now, knowing what we know now, we can pull it all together and build this patient trajectory. And then using your patient trajectory and then all these other patient trajectories, when a new person comes in, we can build potentially a patient trajectory for them as well. Healthcare machine learning has been going on for a long time. It is only recently, though, that we have access to all this data because a lot of hospitals are now digitized. So with this increased amount of data, we can now start to take some of the techniques that people worked on in the 80s, the 90s, and 2000s and see, does it work on 5 million patients instead of the few hundred that you could sort of cobble together and hand label. Now we have much larger data sets, much more powerful computing powers that we can bring it all together and do really great healthcare for machine learning research.